Today, we're going in-depth on one of many frustrations within our nation's healthcare system. I'm Tisha Powell.
And I'm Lee Zurich. According to a 2023 Harris poll commissioned by the American Academy of Physician Associates, more than 70% of U.S. adults feel the healthcare system is failing to meet their needs. 61% cite affordability as one of the biggest barriers to care.
And that brings us to the high cost of a life-saving treatment that's needed when you're exposed to an animal carrying the deadly rabies virus.
But as reporter Heather Graf found out, those simple shots for many Americans come with a burdensome bill.
This is Hank, mostly mastiff, a little bit of Great Pyrenees in him, and he loves to protect the yard.
Hank was doing exactly that.
Come on, Hanky.
Protecting the yard of Abby Peterson's home in Maryland alongside her two other dogs on an October afternoon in 2023.
The three dogs were just going at this raccoon and picking it up and shaking it and throwing it around and really wanting to kill this thing.
The clash lasted just a few minutes.
Right around there is where the raccoon finally died.
But the fallout for this family has stretched on for months.
The health department came and picked up the raccoon and found out the next day that it was positive for rabies.
Abby knew her pets were not in danger because they'd all been previously vaccinated against rabies. But she soon learned the health department was worried about her.
Because I was the one that washed the dogs and cleaned them up, and there could have been raccoon saliva on the dogs that I had touched. I was told that I needed to go start the rabies shots immediately, and they told me that I just should go to the local ER.
Then, when she got to the emergency room, Abby received another urgent directive.
The PA on call there asked me where the rest of my family was, and she said, well, they all need to get their treatments too, because what if you didn't clean the dogs up thoroughly? And she looked at me and said, do you want them to die? And I said, well, no.
So over the next 2 weeks, Abby, her kids, and her husband all got a series of rabies shots. But then
So this was like the first day of shots.
came the crushing costs.
The first bill that came in was for $6,700.
The total billed to their health insurance about $50,000. And after insurance, Abby says they're still on the hook to pay about $13,000 out of pocket.
Not sure if I wanted to cry first or scream or panic. I mean, I have 3 kids. Like I said, we're self-employed. We own a small business. So it is a burden.
A burden that the National Patient Advocate Foundation hears about often.
It's kind of this microcosm of our entire healthcare system where something is dramatically overpriced, and it's almost like punishing people for something that's completely out of their control.
According to the CDC, human rabies in the U.S. is rare, with only 1 to 3 cases reported annually. But the risk of infection from wild animals still exists, and about 60,000 Americans need the vaccine each year.
You want to come in as soon as you think you may have been exposed.
Dr. Carrie Lehman is chief of emergency medicine at MedStar Georgetown University Hospital in Washington, D.C. And if someone is potentially exposed to rabies, she says the shots are essential.
It's 100% critical because rabies is pretty much universally known to be deadly.
And this series of shots is largely administered in emergency rooms.
That's correct.
Why is that?
What happens is it expires frequently. So you can imagine if you're a small company or a doctor's office, it's not something you'd want to keep on your shelf and let it expire if it costs a lot of money. And the second problem is supply, since it's not made by many, many different companies.
And that leads to a third problem.
As soon as you go into the ER, you're tacking on all these extra costs, and that is built into your final price.
Yeah, I mean, I think that is a worry. Obviously, as a physician and someone who works in a public health arena, I want people to get the shots that they need.
And on Capitol Hill, we found another physician and congressman who feels the same way.
That should never be a choice.
Representative Ami Bera of California says it was his own run-in with a rabid fox that opened his eyes to this cost of care issue in the spring of 2022.
Felt a nip at the back of my left ankle, and it was a fox. And I had my umbrella with me, so it was fighting it off, but it kept coming at me.
The fox bit at least 9 people on the Capitol grounds before it was captured. And when Bera found teeth marks in his pants, he got the rabies vaccine right away.
I had the luxury as a member of Congress to be able to go to Walter Reed and my care was covered. So then we started to think about, well, what would happen if you were uninsured and you didn't have that access to care? The shots, all of that could add up to $20,000, $30,000.
Barrett then proposed this legislation he calls the Affordable Rabies Treatment for All Act. It would establish a reimbursement program for healthcare providers that administer post-exposure rabies vaccines to uninsured people. And it would allow the Department of Health and Human Services to award grant money for local health departments to keep the shots in stock.
Something like this that is rare, but the therapy is necessary to save someone's life, that should be something that everyone should have universal access to.
Will you keep trying?
Yeah, absolutely. And again, as these stories get out there, we'll keep pushing it.
Not soon enough for Abby,
And this is how much we currently owe.
but she'll keep pushing too,
The only way that change gets made is by people knowing about it.
and feels her family can't afford to stay silent.
Is this another example of this country's healthcare system being broken?
Oh my gosh, yes. I mean, it just should not cost that much money.
Health officials say exposure to rabbit bats is the leading cause of rabies deaths in this country. It can also spread to people and pets through raccoons, foxes, and skunks. If you are bitten, scratched, or unsure whether you've been exposed, you should talk to a doctor right away.